1027 1035 WICY, your feel good favorites from the 80s and more. It's John Kazar, joined by Dr. Lisa Mark with Hyde Medical Center. We've been doing updates out of the Hyde Medical Center for what seems to be at least 14, 15 months now. It's been a long journey, Lisa, but I can finally say we're looking pretty good.
It has, and I agree with you. Things are looking up quite a bit.
Yeah, we'll start off with the fact that Franklin County currently, as we speak, has a 0% positivity rate.
Yes, there have been a lot of really positive changes occurring across the state recently with COVID, and restrictions have been relaxed at many businesses and public places. But we should focus today on something positive that's close to home and specific to Franklin County.
Yeah, which is very nice.
Yeah. Over the weekend, officially hit a 0% positivity rate for cases of COVID-19, and as of Monday, there was only one active case in the county.
Wow. It's hard to believe we finally got here. We all thought this could be a possibility, and it really took the vaccinations to make this happen, I think, without a doubt.
It did. I mean, this is a tremendously positive thing for all of us, and infection rates are still rising in some areas, but about 46% of America now is fully vaccinated. That is still far below the 70 to 90% rate that we like to see to achieve herd immunity.
Right.
Now, we still have a long way to go, but locally, we'd like to celebrate that milestone and just remind everybody that now is not really the time to get too lax. Vaccines that we have are safe and effective in protecting people, and we want to urge anyone who has not received their vaccine to go and get one.
Yeah, absolutely. I this week I'm going to get my second shot of the Pfizer, and I don't mind sharing that information. And it's going to feel pretty good to know that I'm a part of this initiative that's really just been so great. I mean, by July 4th, our president wants us to be 70%, at least halfway vaccinated. Do you think that's just a side question, do you think that's a possibility at this point?
All comers, that's an aggressive goal, but it's a possibility.
Okay, that's a fair word to use also. I like that. Aggressive's good. Mask mandates continue, though, at hospitals, don't they?
Correct. And while there's so much relaxing in the general public and people really want to move towards normal, hospitals are held to a slightly different standard, and we're still required to mask while we're in the hospital. It's a New York State Department of Health mandate, and it's also a really good way to protect our people, patients, and visitors at Hyde.
Totally. So now we're going to break down into something a little different here. The future of COVID-19 as a whole and vaccines. Where do you want to start with this?
So lots of questions around COVID vaccines. Do we need a booster? Can we mix brands? So how long is the protection going to last? We do have some important updates that people should be aware of. Booster shots. So we don't know exactly when people will need a booster, but the basic science of antibodies and immunity tells us that the immunity decreases over time, and we get boosters for other shots that we get, like tetanus, for example. So it's likely we'll need one eventually, but we don't know exactly when.
Okay, totally. And so with all this, the future of it, and there's, again, with these different strains still coming out, right? I mean, a couple I've heard of.
Right. It's important that we follow the clinical trials to see how the different vaccines that are on the market will help protect us against the different variants. That's
why I love you doctors. You have to be like overly analytical with this stuff because we're talking about health, we're talking about lives, okay?
Absolutely.
So you can't be analytical enough. So
absolutely.
All right, Dr. Lisa Mark with us from the Hyde Medical Center, and I will say this right now. It's been great having you on. I hope to have you on again soon. Anything else you want to add?
No, that's it for today, John. Thank you so much.
All right, you take care of yourself, okay?
Thanks.
All right, this is an update out of Hyde Medical Center on 1027 1035 WICY inside the community.